I'm Brittany Wade. I'm a nursing student at Henderson State University, and today we're going to be doing a neuro exam. So I would start off just doing a mental exam and just seeing how alert and oriented my patient was. So, what is your name and birthday?
Ryan Wade. 7/20/87.
Okay. Can you count backwards by tens from 100 for me?
90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Okay. Then I would ask like a general knowledge question, like, do you know who the first president was?
George Washington.
Washington. Okay. And then during this time, I'd also be assessing his vocabulary. All right, next we're going to assess your cranial nerves. So first we're going to do a smell test, and I'm going to have you close your eyes, and I'm going to have a different smell by each nostril, and I just want you to tell me what it is, okay? So this is by your left one.
Alcohol.
Okay.
Banana, candy, I don't know.
Yes, Laffy Taffy. All right, next we're going to test, you can open your eyes now. Next we're going to test your optic nerve, so we'll start by looking at the eye chart and doing an eye exam. So if you'll just cover up your right eye for me and read the small sign that you can read.
D, E, F, P, O, T.
Perfect. And then if you'll cover up your left eye. Same.
T, O, P, F, E, D. It's backwards. What?
Okay. Next, I would use my ophthalmoscope to look inside both of his eyes. I would look for a red eye reflex and then determine whether his disc margins were sharp or not. I don't have one of those today. I also don't have a pen light, but if I did, I would just look straight ahead for me, and I would just shine the light just to assess that his pupils were round and reactive to light, and that they constricted symmetrically on both sides. Okay, can you look at this for me and then look past my shoulder? Just keep your eyes straight though, just look. Okay, then I would also test his accommodation of his eyes by having him look past my shoulder. Okay, next I'm just gonna hold my hands out and you just tell me whenever you can see my fingers, okay?
No.
Hmm?
No.
Whoa.
No. No.
Okay, perfect. Thank you. Next, we are going to do cranial nerve 5. So I'm going to have you clench your teeth with my hands on your cheeks. Okay, and his cheeks tense up symmetrically on both sides. Next, for cranial nerve 5, we're going to do objects that are sharp, dull, and soft on his face, and just to make sure he can identify them symmetrically. I'm going to just do one side, but I would do his forehead, cheek, and chin. Okay, will you close your eyes?
Dull. 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 Sharp. 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 Soft. Soft. Soft.
Okay, I'm not going to do this, so my patient will continue to finish this assessment with me, but next I would test for a corneal reflex by just putting the edge of a cotton swab against his eye to make sure he reacted, which he would. Okay, next I'm going to have you, will you raise your eyebrows? Okay, can you puff out your cheeks? Can you smile? Round? Perfect. Okay. Next we're going to test cranial nerve 8, so I would do the Weber and the Ryan test, which this is my tuning fork that we're going to be using today. So just tell me if you hear a noise bilaterally in both ears, okay? Just for the sake of argument. Yes.
Okay.
Okay, and then I would do the Ryan test and just by bringing the tuning fork behind either ear and counting how many seconds till he didn't hear a noise anymore. Okay, next I would do a gag reflex, which I'm sure that will be intact, so I would just stick a tongue depressor back in his mouth till he gagged. You can just, yeah. Okay, cranial nerve 11, we're going to test his neck and shoulder resistance, so if you'll just push up against my hands. Okay, and then if you'll turn your head that way against my hand, and then this way. Okay, so he has 5 out of 5 strength with that. And then lastly, for the cranial nerves, for cranial nerve 12, we're just going to look at our tongue here. Make sure you can go left, right, up, and down. Okay. Next, we'll be doing our motor skills. So, I want you to do both your hands at the same time, but will you do your fingers to nose 3 times? Evenly. Mm-hmm. Okay, now we're gonna do hip flexion and extension. So I'll just have, you can do both legs at the same time. If you'll just pull up against my hands. Yep, harder. Okay, and then down. And so strength is symmetrical on both sides. Next, we're going to do, we'll do our hip flexors, just abduction and adduction. So if you'll just push in, okay, and pull out. All right, next we'll do our knee. So if you'll push up against my hands, okay, back. All right, and then if you'll do our gas pedals with your feet. So press down on the gas pedal, and then pull up, okay, great. Next, we're gonna do our sensory test. So this is where we're gonna do our sharp, dull, and soft object, and we would do it on our upper and lower arm, upper and lower leg, and our chest. For the sake of time, I'm just going to do it on his upper and lower arm on one side. Will you close your eyes for me? Oh, already closed. Perfect. Okay, just tell me if this is sharp, dull, or soft, okay?
Soft. Soft. Sharp. Dull.
Good job.
Sharp. Dull.
Good job. Okay, now I'm going to get you to close your eyes again and tell me what direction I'm moving your toe. Okay?
Down. Up.
Okay, good job. Now I'm going to draw on your hand. You can open your eyes now. Or, well, no, don't open them. Just tell me what letter I'm drawing in your hand, okay? And this is to test graphesthesia.
R.
Okay, good job. Next, I'm going to place an object in his hand and just determine whether he can tell the size, texture, and shape of what it is. Okay.
Small toy.
Okay.
Maybe wooden.
Okay, good job. Then lastly, we're going to test our deep tendon reflexes. So we'll just use this for assessment purposes today. All right, we're going to do our bicep, tricep, and radial area first. So can you move it? Thank you. Okay, then we're going to do our knee. And our ankle. Thank you. All right, and that concludes our neurological assessment for today.